Now, lung parenchymal disorders, interstitial lung disorders, alveolar disorders can be very well compared with the conditions of either kshataja kasa or kshayaja kasa. Okay. Now, kshata means there is an injury. That injury may be external injury or internal injury. Okay. Okay. Even it may be the injury to the lung tissues also, because of the atelectasis or fibrosis, okay, collapse, etc. That injury can be also considered, or it may be external injuries also, like spontaneous pneumothorax, etc. Now we shall see kshataja kasa first. So we know that kshata means injury. As I told, it may be structural or functional or immunological injuries. Okay, so it is not always compulsorily an external injury when I say kshata. Kshata may be internal also. Now, in this condition, what exactly happens is the pathology will going to reach the lung parenchyma. Pathology will going to reach the lung parenchyma, and there will be destruction of the normal configuration of the mucosa and the lung parenchyma. This is all chronic obstructive pulmonary disorders or so many other alveolar disorders, interstitial lung disease, okay, and chronic disorders, etc. And there is a normal configuration of the mucosa and the lung parenchyma is get affected. So there is a desquamation of the peripheral of the epithelial tissues, degeneration is taking place, lung volume is decreased, okay, fibrosis is taking place, calcification of the tissue is taking place, and totally the functional capacity of the lung is get reduced, and there is also obstruction to the airflow and also reduced diffusion. Perfusion diffusion ratio will be get altered. That means kshata means all the structure and functional loss will be there. Okay, so what is the symptoms? If you see the classics, the symptoms which are seen in kshataja kasa is frequent jwara, because now patient is immunodeficient. Okay, frequent jwara will be there because of the structural and functional injury to the lung. The lung is now more vulnerable for the infections. Okay, any type of the infection, because immunity of the lung respiratory system has been lost now. Okay, so now it is prone to different types of infections, so frequent jwara will be there. Patient may be the victim of any bacterial or viral or whatever the disease. Okay, so he may be a victim of tuberculosis, he may be a victim of cystic fibrosis, recurrent infections due to cystic fibrosis. Okay, so he may be getting so many these parasitic infections. Okay, so anything can happen here. Frequent jwara is there. Prana and vojakshaya is there. See, this is how the immunity is coming down. Okay, there is prana and vojakshaya is there. That suggests that there is an immunocompromised state. Patient is also having loss of weight. Okay, see, these are the very clear-cut symptoms which are mentioned in the kshataja kasa. Now, all these symptoms are seen in case of lung parenchymal disease. Okay, lung parenchyma means it may be alveolar disease or interstitial lung disorders or infective lung disorders, lung parenchymal disorders like tuberculosis, anything. Okay, now there is all the symptoms of chronicity will be seen. The classics very clearly explains, Ayurveda classics. What? There is poor weight gain, constitutional symptoms. Okay, poor appetite, another one more constitutional symptom. Emaciation, and there is also mediastinal shifting. Mediastinal shifting. Okay, sthana hridayam manyate chutam. This sentence is mentioned. So patient feels that the hridaya is get displaced from its original site. Okay, that is shifting of the apex beat. Shifting of the apex beat is possible when the lung volume is lost. In the thoracic cavity, in the mediastinum, when the that means the lung volume is lost, like because of fibrosis, atelectasis, etc., then that will be shifting from one side to another side. Okay, so maybe hydrothorax, pneumothorax, pyothorax, bronchiectasis, many conditions. Okay, so now very less parenchyma is performing the ventilation. Maximum parenchyma has been lost. Okay, very less performance parenchyma is left to perform the function of ventilation. So therefore patient is having breathing difficulty. Okay, breathing difficulty is also there. Therefore Charaka says that the treatment is very difficult. Okay, in case of kshataja kasa, treatment is quite difficult because this is a chronic stage which involves the whole lung parenchyma. Okay, and there may be fibrosis, calcification, whatever modern contemporary science says. So we consider under the kshataja kasa because the lung has been injured functionally and structurally. Therefore, nothing, very less parenchyma is left there. and within that limited parenchymal, lung has to do the work. Therefore, patient have got all the constitutional symptoms along with the dyspnea, breathing difficulty. So this is all about kshataja kasa. Now, kshataja kasa treatment. Now, what is the treatment that you go for the kshataja kasa? Okay, we know that it's emaciated conditions, nothing. Bala mamsa vivardhana, what Charaka says, go for bala mamsa vivardhana is the best treatment. Okay, now what are the drugs that you'll give in such condition? Madura, Brahmana, Madura drugs and as well as Brahmana Chikisa we have to follow. Again, he says that Jivaniya treatment should be given. Jivaniya Sarpi is indicated in case of Kshataja Kasa. Okay, Rasayana treatment is given. Rasayana treatment sometimes includes the Makaradvaja, Rasamanikya, Abrakabhasma, Rajatabhasma can be also given. Okay, then local Abhyanga to the chest. Yes, this is always good. Like Chandramala Lakshadi Taila or can be done. Chandramala Lakshadi Taila Abhyanga can be done. Now, as it is a chronic condition, there will be micro mineral deficiency. Okay, so you have to supplement the micro minerals also. Okay, especially for the lung parenchyma and some respiratory mucosa, vitamin A and as well as zinc. These are the two important things. So we have got selenium, one more immunomodulator drug, selenium, micronutrient. So selenium is rich in lashuna. Okay, zinc we know that so many Rasanjana preparations etc. is there. Yashadabhasma is there. Then copper, we know that so many copper preparations. Vitamin A, Shigru is very rich in vitamin A. So you can make an ideal combination of all these things and you have to give it. Okay, this will take care the micromineral deficiencies which can occur in case of a chronic respiratory conditions like Kshataja Kasa. Now lastly we come to the Kshayaja Kasa. Once a Kshata is happened, injury is there. Now there is loss complete, Kshaya. Okay, so this is called a Kshayaja Kasa. So this is almost all the last case because last stage because everything has been lost here. Everything has been lost. This is the final stage of the chronicity. Final stage of the chronicity. There is total loss of the tissue. Okay, lung is undergone total collapse. Fibrosis is there. Atelectasis is there. Pyothorax is there. Like conditions. Okay. So what treatment you will give in this condition? And if you look into the Kshayaja Kasa in Charaka, so he gives so many even Arishta Lakshana like things. Jyotishamiva Darshanam. Okay. Then Panipadas Jyotisha Iva Darshanam, Srimad Darshana Lochanam. Okay. Edematous changes. Okay. So that means there is also edema forming now because of the obstruction and all. Okay. That means superior vena cava, inferior vena cava obstruction, and that means total fluid balance has been gone, and that leads to different types of enema. So that may lead to such presentations like a Srimad Darshan Lochana. Okay, because usually we know that edema patient, when he is seen from a long distance, he looks very shiny and beautiful. Srimad Darshan Lochana, Panitala Slakshnata. So like that, many symptoms are mentioned. Okay, in case of a Kshayaja Kasa. So this is the final stage. The treatment is Dhatu Vardhana Chikisa. Treatment which has to be followed is Dhatu Vardhana Chikisa, Rasayana Chikisa, and Jivaniya Sarpi, and also Vidaryadi Grita. Okay, and then Brahmana Dhumapana can be given. So this is all about Kshayaja Kasa. Okay, so in Kshayaja Kasa there may be sometime blood sputum is also coming on. So he is having dry cough followed by some blood sputum, blood mixed with sputum will be there. Okay, I think Paravata Kujana will be also there. So they are all indicating the different types of respiratory difficulties, breathing difficulties. Okay, now this is about the Kasa. Now this Kshayaja Kasa, Kshataja Kasa and whole Kasa, actually this is basically mentioned by Charaka, and this explanation also includes the adult patient also. Okay, but we are now here considering to the children. So all the symptoms which are mentioned here may not be seen in the children. Because Charaka explains basically, he explained for all, including children, but all the symptoms which are normally seen in the adults may not be seen in children. Okay, so point-wise consideration is very difficult. If you consider point-wise, then it is difficult because Kashyapa Samhita, there is no much explanation available regarding this Kasa. Of course, Lagutra is there is mentioning of the Shushka Kasa, etc. is mentioned, but treatment is not properly mentioned there. So we have to consider the explanation given by Charaka, Shushruta and Vagbhata only. which is also mentioned for the adults. So there are some limitations are there. Okay, we cannot attribute all the symptoms and try to find out here, but this is how we have to consider. A chronic respiratory disease in children, maybe a tubercular like condition, some alveolar problems, okay, chronic bronchial asthmas in children, so they can be all considered under this category, or hyperreactive airway disease, etc., can be considered under this particular category. So this is all about the treatment of kasa. We have seen vataja, pittaja and kaphaja kasa, kshayaja and kshataja kasa, kshataja and kshayaja kasa. So we have seen that. So in short, now this here the only protocol has been mentioned. The drug that you will use, that depends upon the yukti of the patient, yukti of the physician and the bala of the patient. Okay, so with this we conclude. Thank you very much for watching, and don't forget to subscribe my channel, and also please give your valuable comments. Okay, thank you very much.